We're down to this before the tea break. Okay, I'll make it fast. Basically, how to assess? It involves everyone, right? From GP, primary care doctors, polyclinic to psychiatrists. So in this section, I'll be talking from this angle. Um, First, we must know that in gambling disorder is actually a hidden disorder. It's not like the drug and alcohol, right? Drug and alcohol, you drink a glass of beer, you drink a little bit more, you get drunk, right? You can actually tell the behavior of the drinker. Someone who takes drug, right, inject himself or took some even heavy dose of benzos, for example, you can tell, right? Becomes sedated. But gambling, no. It's a hidden disorder. There's no objective test. There's no urine test, no blood test, no genetic test, whatever you name it. There's just no test at all. So how do we find out whether a person has a gambling disorder? Um, okay. Gamblers, they tend to hide or deny the problems, right? They won't tell you straight away. They'll keep it to themselves. This is part of the cover-up, right? Characteristic. And if you have treated adult patients, I'm sure all of us have, and you've probably provided care to someone who have currently or in the past history of gambling problems, okay? Whether you know it or not, right? And although 1 in 10 primary care patients, okay, may have a gambling problem, those visiting GP clinics and polyclinics, 1 in 10, you won't find patients telling you voluntarily, I have a gambling problem. Do y'all have that? Someone coming to you to say that, I have a gambling problem, please help me. I don't think so. So this is not the way they present usually. What they do is they come instead with vague, non-specific symptoms, right? Very vague, non-specific, like insomnia, GI symptoms, right? CVS, respiratory, all kind of physical symptoms or psychological complaints, all right? Like feeling down in the mood, right? I don't feel good. I feel anxious. Sometimes they complain about social difficulties. Sometimes they come to you just to get MC, right? Because they just feel lousy about going to work. So all these problems are there, very very non-specific, but they stop short of telling you I have a gambling problem. Okay. So although such complaints are frequently encountered at our practice, especially the primary healthcare setting, the gambling disorders are fortunately not detected, usually overlooked by physicians, okay? And very few healthcare providers actually ask the patients about their gambling problems. Do you have a gambling problem? You've been coming to me for MCs all this while, and it's World Cup, right? Are you betting a lot? So there's some clues here and there for you to suspect. And pathologic gambling, the most severe form, remains largely undiagnosed even among the at-risk population. So who are those at risk? Those are who have an early age of onset of gambling. Okay, those are Chinese New Year, they already gamble with some money with their friends. The male gender, the unemployed people, those with poor academic performance, those with depression, anxiety, right, personality disorders, whole host of them. Drugs and alcohol. So these are the at-risk population. Okay. So, but the good news is, although there are no tests, no blood tests, urine tests, there are good screening tools out there. So screening is recommended. This is one of the CBG guidelines. This is a recommendation. Screening for gambling disorder at the primary care setting is recommended for patients who present with frequent physical and psychological complaints, or the history of a substance and alcohol problems. Okay, so you come across someone with this, do ask, just ask. It's a very quick question. Ask, do you have a history of gambling? Do you gamble frequently? Okay, and screening for gambling disorders is recommended if the gambling is a regular habitual activity. So if someone who tells you I gamble every week, yeah, please screen. Someone tells you I gamble maybe once a month, every month, just screen it. Because after all, this person may be actually a gambler with problems. The screening for gambling disorders should be routinely performed as part of all psychiatric assessment. This is for the psychiatrists and those in a mental health setting, right? Especially those with mental health problems. And another recommendation, history from the families and the significant others, very important. The corroborative history, very important, because gamblers will not offer you information even though you are treating the patient. Sometimes you take 3, 4, 5 sessions to build some rapport. with the gambler. But history from the family, almost always very fast. You can get it from them, and most of the time accurate history. Okay. So like I said, there are no tests, but we have screening tools. So screening tools is very necessary because gambling is such a hidden condition. And we have a lot of gambling tools available, right? You can actually go online and search, and I believe some of them are online. You can do it online also, or download the PDF format. It's a South Oaks gambling screen. This is the oldest gambling screen available. But very old, very long, based on the DSM-3 rather than the current DSM-4. So you can use it, but pretty long. Lie back questionnaire, just 2 questions. 2 questions. If one of them is positive, then this person is likely a gambler with problems. So refer the patient for further assessment. The CPGI and the PGSI, right, are 2 versions from the Canadian side. Okay. The PGSI is a shorter version. I think the 9 questions of the longer version, 30 over questions of the CPGI, but both are just as useful. And also the knots. So I would advise you, like, if you have a need to do some screening in your busy clinic, maybe use the lie back questionnaire. Right, just 2 questions only. You can just download the form, or you just simply in your head you can remember the two questions. Right? Have you ever lied about your gambling behavior or the betting more than you can afford? There are different versions of the lie back, some actually out there. So all of them are useful, you can use them. Alright. So a positive screening result just tells you that this person may have a possible gambling disorder. Doesn't mean he has, right? So refer to the appropriate professionals, alright? The psychiatrists, the addiction counselors would be very necessary for further evaluation, right? To confirm whether he has a problem gambling or this person has a pathologic gambling, okay? So the recommendation would be an individual who is screened positive for gambling disorder should be referred, right? Should be referred to the appropriate professionals for further clinical evaluation. Those in the primary care, don't attempt to treat them because it really takes up a lot of your time. Okay, really a lot of time, and sometimes you don't feel, they don't come back to you, right? If you don't engage them appropriately or with the amount of time. So once the important job for you is to detect, screen them. Alright, you're likely a gambler with problems. I want to refer you for further assessment. That's the thing that I hope that all of you can do that, because once you detect early, you can treat them quickly and prevent all the problems from escalating. Okay, so this is the part meant more for the psychiatrists, the addiction professionals, okay, or the mental health professionals. Detailed clinical assessment is usually required. So it takes a long time, usually an hour plus, in order to get a full picture. What do? We want to assess the severity of the gambling behavior, right? From when you start gambling to the whole typical 1 week of what is your gambling activities, what you gamble on, right? How much you gamble, right? What is your salary? So what is your amount bet based on proportion to your salary? That kind of history, and finding out the criteria. Just now we saw the 10 criteria of the DSM, confirming the diagnosis of pathological gambling. Right, we want to assess any comorbid mental health problems. Very important. Depression is very common. Suicide thoughts, all this are very common. And then formulating a very effective treatment plan for the patient. Right, all this takes a full assessment. So a comprehensive assessment is best performed by the multidisciplinary team. Right, those with psychiatrists, teaching counselors, and mental health clinicians. So a whole group of people in order to do that, right? In order to help not just the gamblers but also the family members. Okay. Okay. So the key assessment, the key aspects of the assessment should include all this following in a yellow. This one recommendation: a full psychiatric history. Okay. A detailed assessment of the gambling behavior. We talked about it just now. The problems related to the gambling. Right, the reasons for consultation. Why are you here today? Why are you seeking treatment for your gambling? Most of them will say that I need help because I in very deep financial problems.